All right, so here's the clinical application osmosis. Remember the previous one, we focused on red blood cells. But what I wanted to look at here are the two different pathological conditions of dehydration and overhydration. Overhydration would be just water intoxication. All right. Now, the cause of this could be excessive water intake. You might have heard about the lady in Sacramento that was trying to win, I think it was a Wii or something. And she was in this radio contest to see who could drink the most water. And she ended up dying. And the reason behind that is because there was excessive water intake where you dilute down the electrolytes, and then you have these shifts in water. All right. So excessive water intake can cause that. We call that water intoxication. But not just water intake, but where we're not getting rid of water when we have it. All right. And there's a condition called syndrome of inappropriate antidiuretic hormone secretion, which is the SIADH. Basically, what's happening here, think of diuresis or diuretic as getting rid of water. Typically, we have medications that help us get rid of water. They're called diuretics. Antidiuretic means that it's inhibiting diuresis. So that means that we're not getting rid of water. So the antidiuretic hormone is a hormone that holds onto water when we have low blood pressure. Okay, so when there is inappropriate antidiuretic hormone secretion, we're going to keep holding on to water. All right. The effect of this, we're going to have that decreased extracellular osmolarity, and that means that the water on the outside of the cell is going to be greater than it is on the inside of the cell. And what will happen is the water will move into the cells and it'll cause them to burst. Again, we call this hemolysis or lysis. As far as what can happen there, if you think of what happens, think of that of the cell. We have a lot of potassium on the inside of the cell. When that cell bursts and breaks open, we're going to release a lot of potassium to the external environment, and so we're going to see some effects of that. Clinical manifestations of that could be some cardiac arrhythmias. We'll see neurological changes like headaches, seizures, cerebral edema. So those brain cells, the tissue cells, are going to swell. In the lungs or pulmonary system, we're going to see shortness of breath, and that's because they're going to have pulmonary edema from that excess fluid. Now, dehydration is going to be the opposite. All right, this is where we're going to lose water. This can be lost through sweating, through vomiting, diarrhea, or even just inadequate water intake. Okay. Now, the effect of this is going to be the opposite of water intoxication. We're going to have that increased extracellular osmolarity. We're going to have water that's going to move from the inside of the cell to the extracellular fluid to try to dilute that out. And when that happens, those cells are going to shrink or crenate, and then those cells are probably not going to work as well. All right, some of the clinical manifestations here, we're going to have confusion. All right, lethargy, which is going to be due to the shrunken brain cells. Keep in mind that lethargy is a lot more than fatigue. It's a lot more than just being tired. These individuals are not going to likely be able to respond or to be rousable. And if they are, they're probably not going to make much sense. All right, so keep in mind that lethargy is a little bit more than just fatigue. And then you're going to see the cardiac manifestations. You're going to see tachycardia, which is because you have low fluid. Your heart's going to try to compensate to bring up the blood pressure, so it's going to pump harder. You're going to see low blood pressure, like hypotension, from that reduced fluid volume. Okay, so this is a clinical application in osmosis related to dehydration and overhydration.